All right, my friends, if you're ready to shop, I'm here to help. Here's the Health Sherpa website. I put in the zip code of 78613 for a female age 35 in Williamson County with a household income of 40,000. Now, I know those of you that are self-employed that you probably don't have a crystal ball that tells you exactly how much money you're going to make next year, but you want to be as accurate as possible when estimating your income because this will determine the amount of savings off retail value of the plan. Now, the term savings is also referred to as a subsidy or a tax credit. But friends, I don't think of it as a discount. I think of it more as a loan. If you make more money than you say you're going to in 2024, you may owe part, if not all of it, back. So going down under plan results for plan year 2024, you can see right here that that's plan year 2024. If you're shopping for the rest of this year, you of course want to change it to 2023, but then you're going to need to shop again for 2024. Starting with the very first plan here, you'll see the retail value is $332.63. But with a subsidy, it's only $18.63. And people get excited when they see such a low monthly premium. But what you may not realize is that your out-of-pocket maximum is now $9,400. That's just for an individual. So if you have a major surgery, hospitalization, or even expecting a baby, be sure to put away that monthly savings so you can afford to pay that large out-of-pocket maximum at the time of the event. Also, in my opinion, you'll want to avoid any plans that have the words after deductible right here for any doctors or specialty visits, because that means you're literally paying full price every time you go to the doctor until you spend the full health deductible right here, which is $84.80, before even your visits are covered. So when I shop for folks that are looking for AC Marketplace plans, I put in their demographics, but then our next step is to make sure all of their doctors are in network and they need to know how much their medications are going to cost on a monthly basis. So notice we're starting off at 125 plans available up here. You're going to add your specific doctor by clicking Add Provider. And then you're going to go and type in, I'm going to type in Virginia Drumming. Virginia is a wonderful doctor here in the Cedar Park area. Then you're going to click Add and Done. You notice that it didn't highlight this. You've got to manually check the box for you. That way it adds it as a filter. Once the box is checked, you'll see the number of plans in network went down to 57 plans. Now, notice to the doctor's name, it will say in green, takes this plan. Now we're going to add our medication. So under Add Prescriptions, let's type in Zoloft because that's a common depression medication. Oh, if I could spell it right. All right, and we'll just say the brand name here. Click Done. You're going to need to do this for every medication that you want to get a pricing on. And then once you're finished, go back and click the check mark again. Now, what I want you to see is on the right-hand side here, in green means you're good. Red, not so good. Prescription not covered, okay? When you're starting a new plan and filling your medication for the first time, be sure to check out the pricing using your health coverage first, then compare it to something like GoodRx. GoodRx is an app or a discount plan you can find online. I want you to do whatever is least expensive for you. There's no need to pay $25 copay for a generic drug if you can find it less expensive doing cash pay and using the GoodRx app for the discount. Now, if you have a brand name drug and no generic alternative is available, I want you to check out the manufacturer coupons or payment assistance plans that may be available to you. To find non-narcotic medications at lower cost, I also recommend researching prices through qualityprescriptiondrugs.com, and that's a pharmacy through Canada that does mail prescriptions. So we've covered so far how to make sure your doctors are in network and how to keep your medications costs as low as possible. Now let's focus on how you're going to use the plan in the event of a large claim. So I'm going to scroll through these plans. It just kind of depends on your specific scenario. If you know you're going to have a surgery, a birth of a baby, C-section, you want to keep your out-of-pocket as low as possible and make sure your doctors have an established rate. As you scroll through, you may be noticing that you're paying more money for your monthly premium, and that can reduce the amount of deductible, but it typically does not change your max out of pocket. Notice right here, even with a zero deductible plan, your max out of pocket is $9,450. Now let's talk about what a deductible is. A deductible is the first thing you pay before insurance kicks in. If you're not sure, you can hover over these and it'll tell you the definition. So if you're going to have a surgery and your surgery is $25,000, you are going to pay whatever the deductible is. Then insurance starts paying a portion of the bill. This is called coinsurance. Now, coinsurance, you don't see it here, but it is the difference between your out-of-pocket maximum and your deductible. So I want you to think of this. A plus B equals C. Your deductible plus your coinsurance equals your max out-of-pocket. You're still responsible for a percentage of the bill once your deductible is met, and that's the percentage you pay until your out-of-pocket maximum is reached. So again, deductible plus coinsurance equals max out-of-pocket. I don't know about you, but even the monthly premium may be more affordable monthly, but sometimes when something hits the fan and you have to meet your out-of-pocket max, to budget $9,450 for an individual or up to $18,900 for a family is a stretch for most people. And that's why I'm so passionate about teaching people how to shop smart for health coverage, because this is not meant for everybody. These plans are designed for folks that need help with financial assistance or they need additional treatments. But for folks that are healthy, financially and physically, I have a much better alternative and provide access using PPO networks. So speaking of networks, I'm going to highlight up here. The largest type of network is a PPO or preferred provider organization. So when I say PPO, I want you to think of All Access Pass. This is your VIP backstage all access pass to your favorite concert. You get to choose where you want to go, and your coverage travels with you wherever you go. Your benefits work even when you're out of network, and you typically don't have to have a referral to see a specialist. Now, I want you to notice here on the marketplace, there are no PPO networks here in Texas. There are only POS, HMOs, and EPOs available. A POS stands for Point of Service Network and is a mix of an HMO and a PPO plan. You'll still need to choose an in-network primary care provider, but you can see an out-of-network physician without your PCP's referral. It may just cost you more money being out of network. The second largest option is an HMO. HMO stands for Health Maintenance Organization, and with an HMO, you still need to stay in network for your benefits to be payable, and you have to have a referral to see a specialist. The smallest network is an EPO. That stands for Exclusive Provider Organization. On an EPO, services are only covered if you stay in network except for an emergency. For all marketplace plans, be sure you check out the summary of benefits for each plan that you are considering. And that's here under plan details. It'll give you the baseline here, but if you scroll down, it'll say summary of coverage and benefits. And you can search by doing Control F using the find feature. And let's just say you want mental health covered. If you need psychiatric care, there it shows you there's a $50 copay. So you know how much you're covered there. What I want you to notice is on this right-hand column right here where it says out of network, be careful what you're doing. You might not be covered. So the important thing is to stay in network at all times with your health plan if you want to maximize the value and minimize your out-of-pocket, especially if you have a surgery. Keep in mind, if there's a surgery, there's usually 3 parties involved, and you want to make sure that you verify that they are in network prior to the surgery. So those 3 parties are the surgeon, the anesthesiologist, and the surgical facility. Now, through the marketplace, there are no supplemental plans available attached to these plans. And what I mean by that is if you have a large claim, there's nothing to help you there for your financial protection that's built into your plan. So if you're looking to protect your family or yourself financially and offset that out-of-pocket maximum of $9,450, we need to have a separate conversation about what I have to offer because the supplemental benefits that I offer can offset those costs. And in addition to your marketplace plan, I can offer dental, vision, and accident disability plans. Again, this is just an informational session on how to shop smart for your health coverage needs in 2024 if Marketplace is a better fit. Once you've picked a plan, you're going to add it to the cart. Okay, just like you're shopping on Amazon, you add it to your cart. What I want to make sure you do is go to my website using the Health Sherpa link, healthsherpa.com. You can go to Start Shopping Now. You find the best plan for you, going through the same thing that we just went through, save your progress throughout it, and then click Enroll. I would not recommend going through healthcare.gov website because you will get bombarded with phone calls. To protect you and avoid these annoying phone calls, please be sure to use the link above. So once you've picked a plan, you'll want to submit your application and make your first premium payment. I would not recommend going through healthcare.gov website because you will get bombarded by phone calls. Be sure to use the link that I send you via email. And if you need it, just send me an email at healthbenefitswithm@gmail.com. That's healthbenefitswithm@gmail.com. And I will send you an email that has my specific link. This is going to protect you and it's going to help avoid those annoying phone calls because you want to make sure you use my link. Otherwise, you will have people call you nonstop. And it gives me credit for helping you find your right plan. My national producer number or NPN number is 185-111-99. Please keep in mind that I do not handle any customer service or represent any of these carriers. If you need help with enrolling, you can call Health Sherpa at 855-772-2663. And once you've become a client, you want to talk to the provider itself. So if you go through a Blue Cross Blue Shield plan, if you have questions about your specific policy, you need to call Blue Cross Blue Shield. That makes sense. So just to recap, I'm licensed in 25 states, not just Texas. And I enjoy helping others across the nation understand how to shop for their health coverage. All of my states are listed on my website. I'm going to share my website with you now at emily.gotmygocard.com. You can see videos that I've done, and you can reach out to me, email me here. But these are the states that I'm licensed in. So if you have a friend in another state that's paying out of pocket for their health coverage, please feel free, give them my cell phone number. And that's 512-567-9091. I'm happy to have a conversation, make sure everyone is in the best position with their health coverage, even if it's not with me. So lots of information we just went through. If you need advice, I want you to give me a call. I'm happy to guide you where you need to go. But if you're looking for better options other than the Marketplace, you don't qualify for a large subsidy, you're looking for a PPO plan, you're tired of dealing with the government, I want you to call me. Again, 512-567-9091. I hope you have a great day. Thank you so much for taking the time to review this.